I'm Soumitra here. We are from Joy Web Services Private Limited, and I am currently at our client's clinic, that is Dr. Tanvi. She is a gynecologist and a laparoscopy surgeon in Bangalore, well known in the area of, I think, Kundanhalli, right? Marathahalli. Okay, I'm not much convenient with the areas, but this is an endeavor to let you know the person behind a business. Okay, so I would straight away start with a question, and I will put my first question to Dr. Tanvi. Dr. Tanvi, I would just like to know a brief about your background.
Dr. Tanvi Desai. I am basically from Mumbai. I have done my schooling from Parle Tilak Vidyalaya in Vile Parle, and thereafter my MBBS from Nair Hospital. It is quite reputed, especially it was a COVID hospital for past 2 years. And after that I did my post graduation in gynecology from Bhagwati Municipal General Hospital in Borivali West. And thereafter I moved to Bangalore with my husband, who is an electronics engineer. After coming to Bangalore, I have pursued a fellowship in laparoscopy under the mentorship of Dr. B. Ramesh in Rajaji Nagar, Bangalore. Many of you may be aware of Dr. B. Ramesh. He is quite renowned for laparoscopic surgery in India and abroad also. So for 2 years I have undergone rigorous training under him, and after completion of my fellowship I have started my own practice in Marathahalli. So I am consulting at Children's Clinic in Marathahalli near Kundanhalli Gate. Apart from that, I am also attached to some other clinics like RXDX Clinic, Nurture Clinic, and Jivika Hospital on Outer Ring Road.
So how many years you are practicing in Bangalore now currently?
2 years.
2 years you are practicing in
my own practice since 2 years, and after post graduation I have 7 years of experience.
Okay, so you aggregate 7 years you are experienced in this field.
Yes.
And a lot of people are actually existing also, they are talking about your practice. So one question which I am really keen to ask you is, have you faced any particular challenging situation where the diagnosis was difficult and the treatment was difficult to any patient such?
Yeah, one particular incident I will like to share. Especially because of COVID, online consultation was on a boom. People were scared to go out. One particular case some few months back, there was a teenage girl who was having severe abdominal pain, and they consulted a pediatrician who prescribed medicines for pain and vomiting, but after that also she did not have any relief. And then pediatrician advised to undergo a scan. The scan was not very significant, but there was a very small ovarian cyst. After the scan was done, that mother sent me the reports on WhatsApp. I had not even seen the girl, no physical examination. When I spoke to that mother and she told me the symptoms, one thing that clicked in my mind was ovarian torsion. This is something that is quite common in pubertal girls, teenage girls. That means the ovary twists and then it causes severe pain. In case we don't untwist it within 24 hours, then the blood supply to the ovary gets compromised. It will cause gangrene and we have to remove the ovary. So because this was one thing in my mind, I urged them to get a second scan done. The second scan confirmed the diagnosis of ovarian torsion, and immediately we did the surgery and we untwisted the ovary and we saved the ovary. We did not have to remove the ovary, and the patient got relief from her symptoms.
Yes.
So that was one very important case that comes to my mind.
One more thing we ask you. Swati, can you take the camera here? So this was the gift was from some patient of yours.
Yes.
So I was really curious to know about and the story which you told. So can you tell us what the thing is and all about?
This is a handcrafted greeting card with mandala art. It is made by one of my patients who is an artist. The story behind it is that she was married since 15 years and she had a 13-year-old son who unfortunately had cerebral palsy.
I see.
So after speaking to her, I understood that maybe during the first pregnancy she had diabetes which was undiagnosed, because of which the baby got cerebral palsy. And they were having second thoughts about going for a second pregnancy. But after speaking to her and counseling her, I told her that we can take care of everything, we can do the required tests and manage it accordingly with careful monitoring. So she got confidence from me, and then she planned a second pregnancy. Like we had suspected she got diabetes in second pregnancy also.
I see.
So but we already knew of it, so we monitored it carefully, treated it, and then she had an uneventful pregnancy. She has a healthy baby of 4 months. She moved to USA recently, and before going she has gifted me this greeting card.
Super.
So it is very close to my heart.
So there can be any better testimonial than this, isn't it?
Yes,
What do you say?
yes,
So
right.
satisfied clients,
Yes.
definitely. Not
Yeah.
clients actually.
Yeah.
In your case it is patients.
Yes.
So forgive
right.
me because I am in this field, so I am talking clients. Anyway, so one more thing is you're talking about Parle Tilak Vidyalaya.
Yes.
So the people who are educated in Marathi and who are in Mumbai or something, they know Parle Tilak very well.
Yes.
So to get into Parle Tilak as well as graduating from that school, I mean doing SSC, is a great thing, isn't it? So can you tell me about that experience? Did it affect your overall career as such? So do you feel that getting educated in a school like that does matter?
Yes, definitely. Going to a good school where there are good teachers who will guide you constantly and give you confidence to achieve better in life. It definitely forms your career. I would like to mention particularly about 2 teachers from my school. That is Mrs. Vandana Menon and Mrs. Raji. I was an average student till maybe 7th standard, but when these teachers came into my life, they really shaped my career.
Wow.
And they boosted me to work harder
Wow.
and achieve
Wow.
better in my academics.
Why I'm asking is, in the profession of like a doctor, okay, the principles are very important,
Yes.
You do not deviate from the principles which you are thought of. So those must have also contributed to your career here also.
Yes.
So you must be facing also some tempting moments, but you are not getting drifted towards them, isn't it? So that is what I was meaning about. And now can you tell us about what kind of treatments you give or which kind of specializations you have?
Yeah. So basically I am a gynecologist. That means I deal with whatever conditions of the female reproductive organs. It can be pregnancy. The pregnancy part is called obstetrics, and gynecology is relating to reproductive organs but not for pregnant ladies. So basically the problems associated with the uterus, fallopian tubes and ovaries like fibroids, ovarian cysts or ectopic pregnancy. Even another thing is urogynecology. That means any problems associated with incontinence. Some ladies after delivery they have urinary incontinence. So these are basically obstetrics, pregnancy care, delivery, gynecology, laparoscopic surgery and infertility. These are the things that I cater to.
It's some offbeat question. Now, since I have been talking to you some time, can pregnancy be really planned, and can you prescribe some way, or can people come to you for really planning a pregnancy? What is your opinion about it?
Yes, nowadays lot of couples they don't want to plan a baby early after getting married. So they want to enjoy for 1 or 2 years and then they want to plan. So definitely I can help them. They can undergo preconceptional counseling. That is, we will have a look at the female partner and male partner, what are their parameters, and then we can guide them for how many years they can postpone or when they need to plan, whether they need to do any tests or they need to take any supplements, vitamins before planning pregnancy, when to try. There is something called fertile period, so we can guide regarding all that so that they can plan accordingly.
Okay, so if somebody wants to come to you for consultation, which are the clinics where you are available and what are the days or something like that?
Okay. Monday to Saturday in the morning 11 a.m. to 1 p.m. I am available at Children's Clinic, that is near Marathahalli gate.
The place where we are sitting right
Yes, this is the clinic.
now. Monday to Saturday?
Yes.
Okay.
Then in the afternoon, I am available at RxDX Clinic, Bengaluru,
Okay.
and that is 2:30 to 4:30.
Okay.
And then evening 4:30 to 6:30, I am available at
My
GVK Hospital, that is in Outer Ring Road.
Yeah.
So everywhere I am available Monday to Saturday.
Okay, fantastic. So I'm really happy that I could really spend some time with you, because I'm in Pune and having come to Bangalore, I was always wanted to
Yeah.
meet you, and I wish you all the best. Thank you so much.
Thank you very much. It's a pleasure having you both in my clinic.
Great.